Ukrainian Americans are finding different ways to help their homeland, even from thousands of miles away.
Hospitals in Ukraine are struggling, like Children's Hospital in Kyiv. Now, Ukrainian Americans in the medical field are stepping up to help doctors and nurses back home. That includes Dr. Vitaly Poilin, a surgeon at Northwestern Memorial Hospital in Chicago. He joins us now, along with Dr. Olga Myhudiak from the Ukrainian Medical Association of North America.
Dr. Poilin, let's start with you. We do want to thank you both for joining us. Dr. Poilin, you were born in Ukraine. I know you spent years actually helping provide surgical training to doctors back home. Tell us, what are you hearing from family and friends in Ukraine? How are they doing, and what are some of their biggest needs right now?
Thank you for having us on the program today. It's very difficult. I'm originally from Kyiv, and the folks at the center of a city in the hospitals, they're essentially living in the hospitals. They're waiting for casualties to come in. A lot of them are civilians at this point. The folks who are on the outskirts, especially to the north and the south, they are in the thick of it. Some of my friends who are in the medical corps of Ukrainian military, I can't really get a hold of for the past couple of days. So they've seen a lot of civilian casualties and just results of missile and shrapnel attacks.
Dr. Myhudiak, this question's for you. Dr. Poilin is working with you with the Ukrainian Medical Association of North America. What are you hearing about the situation at hospitals in Ukraine right now?
Thank you for having us. I want to say that we're hearing the same thing, a desperate shortage of medical supplies, especially medications. They're really running low.
And Dr. Poilin, what kind of supplies, if running low, and medical assistance have you all sent to Ukraine so far? What's making it there? How's it making it there? And what do you think this effort will look like over the next few weeks as things potentially intensify?
So they need supplies in two areas. One is surgical supplies with bandages and kind of supplies to help with the wounds and the care. But the very big need is in the medications. I'm actually, just as before we went on the air, was getting texts about some plasma products and everything that they're seeking. We are getting lists from Ministry of Health in Ukraine. It's being updated constantly. And we are trying to coordinate the efforts between the individuals as well as hospitals to try to collect that. And with the help of Ukrainian Medical Association of North America, which Olga represents, they actually found a very streamlined and a good way of getting it to where they are needed.
Dr. Myhudiak, what are some of the stories you're hearing from people you know in Ukraine right now about what they're dealing with?
So speaking to people, medical Ukrainians and doctors in Ukraine, they just don't have access to basic medical needs. You know, they're running low on painkillers. Insulin is a big issue right now. Elderly people are running out of insulin. There is a need of aspirin. I mean, anything and everything you can think about, they're running low on.
So how can people help all of us who are watching right now and want to know how we can, we're not doctors, but we want to help the doctors in hospitals right now. What are the best ways to help?
I think, Go ahead.
Go ahead. Sorry. I would suggest for all non-medical people to reach out to your personal networks for medication donations, because that is what Ukrainian Medical Organization is in great need of. We update a list of needs on our Facebook daily. So people can go on Facebook on our Umana page and see exactly what is needed, and that is updated daily. We also can be emailed at umanahelpua@gmail.com. And also for those who want to make a donation, they can go to umana.org, and we will use those funds to buy the medications that we're not getting donated as of right now. And the need, well, there's great need right now, and it's just going to continue happening.
Yeah, I was just going to add, if the medications would be great if people can donate, but donation of money can actually be just as useful, because we do have ability to buy some of the supplies that they need. It will change, and I think it will change in the upcoming weeks and months, potentially more to help with the refugee camps and the humanitarian aid on the border. But for now, this is what they need.
Doctors Poilin and Majchodiak, thank you so much for joining us. Thank you for what you're doing and for giving us all ways to help. We really appreciate your time this morning.
Thank you.
Thank you. Thank you both.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.